So, hello everyone. Good evening. Thank you for joining us today. This is one of two virtual town halls on COVID-19 that we'll be doing this month. And I want to point out that there is a captioning button on the bottom of your screen for Zoom attendees who would like to see closed captions. You'll need to open it and click on the link and activate the closed captioning. My name is Dominic de los Reyes. My pronouns are he and they, and I'm the program coordinator for the Community Health Worker Communication and Outreach Services, or CHWCOS, at Union of Pan Asian Communities, or UPAC. And CHWCOS is funded by the County of San Diego in support of the Live Well San Diego vision for healthy, safe, and thriving communities. And we aim to provide San Diegans, especially from Asian and Pacific Islander communities, with support and resources to prevent and slow the spread of COVID-19. This virtual town hall is welcome to everyone and aims to provide COVID-19 updates and local resources, as well as to be a place where we can talk with each other and answer your questions. I would like to also acknowledge that here in San Diego, we are on the traditional territory of the Kumeyaay people, and that especially for those of us who are immigrants or refugees, it's important for us to be aware of our common struggles for safety, health, and equality. May we be strengthened by remembering our heritage as we work together in solidarity to address a pandemic that will require all of us to resolve. I would also like to give special recognition to Cindy Seto and Leah Brown for providing American Sign Language interpretation for this event, as well as by Nihan Guevara for providing live captioning services. Thank you all for helping to make this an accessible event. In addition, we have community health workers here to present with us to assist attendees who wish to communicate in Karen. That would be Grace Thaw, Tagalog, Jeanette Lucas, or Vietnamese, Tracy Lee. So thank you all for uh, putting on this town hall together with me. Um, so I'll try not to take too long on the presentation to leave space for us to talk as a community. But if you have any questions regarding COVID-19 or the presentation, please feel free to type them into the Q&A box and we can process them together. We can also use the chat box. So we are recording this event, and it's also being, hopefully, if I did it right, streamed on Facebook Live. And so we'll have folks monitoring the comments there as well. If anyone watching this from Facebook would like to participate in the Q&A. So here is the contact information as well for our team, our program. These are our work numbers and email addresses. Feel free to reach out to any or all of us for future conversation or collaboration with our team. We are mobile and can go throughout San Diego County to provide COVID education. And we also have a small supply of hand sanitizer bottles as well as masks. And we would just love to continue being in touch with y'all after tonight. I would like to share this graph with you from Johns Hopkins University. They've been tracking the rates of COVID all over the world with a 7-day moving average. And I just wanted to simply point out that the US is the green line. We are here going upwards, where it kind of looks like right now everyone else is in a more downward trend. And so I wanted to show this graph to kind of make a point that it's an escalating problem for us here in the United States. we're in a rising rate of numbers of COVID. As you can see here in this map of California, um, the numbers as of November 17th show that our cases are totaling 65,601 and 926 people have died from COVID so far as of the 17th. Particularly in Southern California and San Diego County, we have the highest numbers of the whole state as well. So before I go any further with graphs, I wanted to have a brief review of what is COVID. The full name is Severe Acute Respiratory Syndrome Coronavirus Disease of 2019, meaning it was discovered in 2019 and identified then. It's also known as SARS CoV-2, or the second version of SARS, and it's new. That's why it's called novel coronavirus. It's never been seen before in humans until 2019. And in general, there are several types of coronaviruses that can infect humans. And although some are common and usually mild, COVID-19 is having a different effect on people. It People infected with it have a wide range of reactions, from having no symptoms at all to some symptoms that can be managed pretty well at home. Most people do recover from it. But some also need immediate hospitalization because they can get severe symptoms. So they can also spread the virus to others, even if they have no symptoms, or up to 2 days before they show symptoms. So it's kind of scary because of that factor of folks not necessarily knowing that they have it and they can still spread it. So the best thing for us to do right now is focus on prevention, meaning support the body's immune system by doing everything we can to get and stay healthy. And for those who um, are positive with COVID, we just want to support the body's ability to fight it as much as possible. Sometimes in extreme cases, for example, that can mean using machines to assist with breathing. So uh, let's talk about how does this spread, right? The main way that COVID spreads is through respiratory droplets that everyone produces naturally when we cough or talk or sneeze. Each of us give out a little bit of water vapor. That is what can contain COVID-19 if a person is infected with it. So that's why it's important for us to uh, practice not sharing these respiratory droplets, uh, right? So stay at least 6 feet away. Try not to spend more than 15 minutes with another person in close contact for a cumulative total of 15. So not just 15 minutes at one time, but it's been shown that COVID can be passed from an infected person to a non-infected person if over the course of a whole day, they spent a total of 15 minutes together. So in general, the longer people are interacting closely with each other, the higher the risk. Also, these water droplets are sometimes small enough that they can stay in the air for a long amount of time. So if we are going to be in enclosed spaces, we want to make sure that there's good ventilation. So try to have air purifiers or fans, and at least two open air sources like doors or windows that can help kind of sweep away stale air and lower risk of the virus being spread through airborne transmission. Um, Another way that COVID can spread is if these droplets get onto certain surfaces, especially surfaces that are commonly used by multiple people, like doorknobs and things like that. So we want to all be careful about what we're touching and try to avoid touching our faces throughout the day, and also constantly keep our hands clean. Some symptoms of COVID include sore throat, headache, aches and pains, diarrhea, nausea, vomiting. Also, there are some kind of random symptoms too, like pink eye, and if you have a certain type of rash on your skin, or if your fingers or toes get discolored. These are pretty common things, as well as losing a sense of taste or smell. Um, as many as 80% of people that have COVID tend to lose their sense of smell, and that's one of the first things they notice before coming down with more symptoms. Also, you may have noticed in certain public locations, someone will be at the door to check your temperature. If you have a fever, meaning usually 100 degrees or more, that can also be a sign that you will need to get checked for COVID. Um, there are some people whose symptoms escalate very quickly or get very severe. And so, for example, if you observe anyone who has trouble breathing, pain in their chest, any kind of new onset of confusion, um, having a hard time waking up or staying awake, or also if your lips turn blue or your face turns blue, this can be a sign that you're not getting enough oxygen, which is a very immediate emergency situation that you should just call 911 and get immediate medical care. I also wanted to share this Venn diagram of the differences and similarities of flu and COVID. Both are viruses, right, which can be transmitted through respiratory droplets. However, you can see in here that how long it takes for the virus to grow and incubate inside the body before symptoms show up. The time frame is different, um, as well as some of the types of symptoms. People don't usually lose their sense of smell or taste with the flu. One of the big differences, though, is that with the flu, there is a prevention method, and it's a flu shot. So the County of San Diego is really encouraging everyone as much as possible to get a flu shot. That can help your immune system with not having to deal with a potential situation where you have both flu and COVID. Um, Luckily, the more prevention steps are put into place for COVID, it's actually showing up that fewer people are getting the flu as well. So that's even more reason for us to follow prevention methods, such as staying home if you're sick, covering your cough or sneeze, avoid touching your face, washing your hands. If it's not easy for you to frequently wash your hands, you can also use alcohol-based hand sanitizer, at least 60% alcohol. Try to keep your environment clean and disinfect surfaces around you often. Wear face coverings and practice physical distancing, right? Let's see. Folks who are at particularly higher risk for complications and death from COVID are there are conditions listed on this slide: cancer, chronic kidney disease, chronic obstructive pulmonary disease, right? Remembering that COVID is a respiratory disease. And so um, typically we're seeing that people with any of these underlying medical conditions have a harder time dealing with an infection of COVID, and COVID can actually escalate complications from their pre-existing conditions. So we really want to watch out for ourselves and others if they fall into any of these categories. Quit smoking if you can. Even though I know it's a very stressful time, it's will be better for your body in the long run. Also, just to show a quick graph of the types of conditions that were associated with people who unfortunately passed from COVID. Um, I also want to note that there are lots of different conditions that can make a person immunocompromised or have a weak immune system, and such as HIV, AIDS, or maybe being on certain medications that make it harder to fight infections. So, if you are in one of these high risk groups, or if you feel like you may have been exposed to someone with COVID, whether or not you have symptoms, or if you feel like you might have COVID symptoms that we mentioned before. It's really important for you to go get tested for COVID. There are lots of places all over the county, and there are more popping up almost every day, where you can get a free test. You can call 211 to find your closest location. Also, the website coronavirussd.org, I believe. Let me just double check. I always forget if it's org or com. Com. That's the county website for COVID, and they have a lot of resources on there. There's even an interactive map where you can type in your address and it will show you which locations are closest to you where you can get tested. And I also wanted to note that if it's a scary thing to think about someone sticking a very long Q-tip up your nose, um, that might not necessarily be your experience because it depends on the manufacturer. I learned recently that depending on which company a location has partnered with, which makes the COVID tests, sometimes the cotton swab will just be right inside the nostril and not go deeper. So, if you are concerned about that, you can also call ahead and ask um, to be given a description of what your experience might be like at that location. You can also call ahead for some places to make an appointment, but you don't have to at other places. So, um, yeah, you can contact us through our phone and email for more assistance with that as needed. But we just really want to remove barriers for people to get tested for COVID. So I also wanted to show this slide, which gives a general average of amount of time it takes after people get tested. Like what happens? Well, the results of your COVID test get sent to public health or, the government and put into a system where if you end up getting positive results, then there are people called contact tracers who will call you or connect with you and try to link you with resources. For example, if you need a place to stay, uh, if your provider has told you that you need to isolate while you are recovering from COVID-19, then there is a county program called the Temporary Lodging Program, where if you meet the eligibility requirements, there will be a hotel room for you to stay in for 2 weeks or however long your doctor decides you need to be there. You can call 211 for that program as well. And if you feel like you've been exposed, or if you want to um, help keep your family or your housemates safe by being separate from them, that's quarantining. And the temporary lodging program can be used for that as well. Uh, a plus side is that also people are available to help with your mental health in this program, as well as bring you meals 3 times a day, um, and shuttles as well. A shuttle will pick you up from where you are and bring you to the program. And for example, if someone is on dialysis or needs to attend medical appointments, transportation can assist you with that too while you're in that program. And it's not full, they still have lots of space for people to make use of it. But to go back to this, if you do test positive for COVID, another thing the contact tracers would do is gather with you a list of people who you might have also come into contact with during the time that you had COVID, and try to track where and how the virus is spreading, and also inform individuals that they may have been exposed to COVID. So it's important to work with contact tracers, and they can also help you get connected to other social services as well. Um, I didn't mention this yet, but if you don't have a medical provider, you can also call 211, and it's in any language as well. They can connect you with a medical provider who can give you a referral to get tested after talking with you about your symptoms, for example. So don't worry, there are ways where we can get connected to healthcare. Um, so here's a quick checklist that I made to help folks focus on what can we do right now, because the pandemic is so um, widespread. Uh, in case COVID has not yet affected you or your loved ones or your housemates, it's better to be prepared uh, beforehand. So we want to encourage everyone to continue to get their regular medical care. Um, it's it's better in the long run for you to have all of your health um, being, um, properly treated in a timely way, than to avoid going to any doctors or medical facilities simply to try to avoid COVID. It's actually one of the safer places that you can go, because all the staff there are very aware and prepared to minimize risk of COVID being spread. So we encourage everyone to go ahead and get the flu shots and any other immunizations, especially children. Uh, if you are caregivers for anyone, you know, try to prepare any backup plans, have an emergency contact list. Um, for a lot of folks in Asian Pacific Islander communities, especially, it's sometimes part of our culture to want to rely on our own families and solve problems internally, right? And also to focus on caring for others more than ourselves. But in this situation, it's really important that we're all working together as a community to combat this pandemic. So, we really want to encourage you to reach out and educate yourselves, share this information with others. Also, just thank you, everyone who's on this call so far. Um, it really shows a lot that you are, um, taking steps to keep yourself and your family and loved ones safe. So, thank you. Um, let's see. I know I said a lot so far, but this can kind of summarize it up, right? Things we want to avoid are crowded situations, close or physical contact, enclosed spaces, duration of exposure. Uh, Try to keep short amounts of time when you will be in close contact with people. Good things to do are wearing a mask, distancing, using proper hand hygiene, and cleaning and disinfecting, right? So I have a lot more information about the way that the county and the state are handling the increase in COVID cases right now. Um, but I also want to give enough time for folks to ask questions, and we can probably talk about these depending on where the conversation goes. So, yeah, I think I'll leave it there for now, and we can go on to questions. So, Other community health workers, if you will want to speak and or screen share, feel free. Just a reminder to please turn on your camera if you will be speaking to make it easier for others to see you. And yeah, I think that's it. Let's see. Are there any questions? What recommendations do you have for the holidays coming up? Yes. I told you I had a slide for that. Here we go. It was only last Saturday, right, when the county moved everyone into more restrictive tier because COVID is widespread. It's also based on what's called the health order. Um, and so the content in this slide and another one I want to share with you is from that document, which perhaps one of the other panelists can share in the chat if folks want to see the original document. It's also at coronavirus-sd.com. But essentially, the county is encouraging folks to still celebrate holidays coming up and stay connected to family and friends, but in a way that is going to keep you safe from being exposed to COVID or potentially exposing others to COVID. So, if possible, encouraging virtual visits and events or remote. This picture here is of a family at a table with a laptop, visiting with others through the laptop. Um, there are live streaming or televised events at home. I know that a lot of faith communities have been making use of that for regular meetings when they can't in person. Also, there might be some activities that are outdoors, like picking your own produce or food markets that are outdoors, craft fairs. These are um, safer activities than, for example, the traditional Black Friday in person holiday shopping, which might conjure up images of crowds pushing each other because they're so close to each other in order to get to um, items, right? There are also car-based events like drive-in movies, or they're calling them reverse parades, where people stay in their car, but they're still celebrating with each other. Um, there are also food delivery options if you want to try to share meals across households. Uh, there's an idea of sharing um, ingredients or prepared foods and then having them delivered and then eating it together with a video or a call. And of course, feel free to decorate your household. I'm going to call out my partner right now. They already decided it's Christmas time, and there are decorations all over the inside of our house because we're in a pandemic and we can, and we're the ones who get to enjoy it. So, and it's also important for our, to upkeep our mental health to um, participate in holidays and things that we have traditions around to maintain some sense of normalcy, even though this pandemic has really thrown off a lot of our, um, sense of time in certain ways. Is it safe to make food and take it to family and friends? Um, I don't know what the county says beyond this slide, but answering from a personal um, place, I would say yes, in terms of making sure that it's in containers that won't be shared with people as they're making plates for themselves. So, for example, disposable or compostable single use dishes and silverware are encouraged, um, and just kind of maintaining processes of cooking and food sharing that will have a lower risk of COVID going along with it if it's there, right? Um, this second part of that guidance on holidays is about what the county is discouraging folks to do, mainly in-person things, right? And if possible, try to not travel. The TSA and a lot of airports or, you know, um, transportation places um, have developed responses to the pandemic that if you will be traveling, it would be important to plan with a lot of time ahead of time, because sometimes there might be protocol that are new, such as needing to be tested for COVID within a certain window of time before you're allowed to travel. But it just depends. So also, um, I wanted to point out this first bullet point in the not allowed section. It says in-person events or parties with more than 3 households, even if outdoors. So also recently, back when we were in a less restrictive tier, the county was doing they put out a guidance around private gatherings. So this is from October 9th, where, as kind of a harm reduction technique, the county acknowledged that folks are visiting with each other in person despite recommendations not to. But they're saying if you're going to do that, at least try to stick with the same group of people over time. So they're counting it by household, um, while also acknowledging a lot of folks in our communities have many generations in the single household. So that can add up to a lot of people, right? So if they're saying don't have more than 3 shared households, depending on who it is, that might be 50 to 100 people, a lot, right? But I think the idea behind it is try to have a limited amount of quarantine buddies, right? If you're going to be gathering with people that you don't live with, they also encourage you to not visit more than 2 hours at a time, and basically apply multiple prevention methods as layers on top of each other, um, because none of these single methods is going to eliminate risk completely. But so, for example, wear a mask, but then also do stay at least 6 feet away from people, and also um, sanitize or wash your hands frequently. Also keep surfaces clean, right? So it's all about adding up multiple methods. And regarding singing, chanting, shouting, playing instruments such as wind instruments where you blow into it to make music, people have found that this is also a higher risk activity. So it's encouraged for folks to um, try to keep their respiratory droplets to themselves, right? Also, keep a list of the people that you are going to be visiting with in case a contact tracer needs to get a hold of that, right?
Dominic, I just want to piggyback on that. If you were to go out during the day, please write down the location where you're going. And if there are people, just, try to memorize how many people that you talk to. Or if you were to go to a grocery store, just remember to write down the date and the time that you went to that grocery store.
Thank you. Thanks. That's Tracy. And I don't know whether I'm able to see other videos than the interpreters, but that's okay. Yes. Um, There's also a list here that I pulled from the county website around which places are currently open or closed, or what's the amount that they're open. And this is based on potential risk um, from various ways people are interacting with each other in those spaces, right? So a movie theater, for example, is closed right now because staying in the same enclosed air space for 2 hours or more is a very high risk of the air in that space um, potentially getting a lot of people infected with COVID if one person in the room has it, especially with laughing as a reaction to the film. That's just an example, right? Um, a lot of retail stores are open 25% indoors. Also, to give an example, on last Saturday, which was the first day that all these different businesses had to implement new changes, people weren't already um, keeping 6 feet distance, and staff were just letting in the usual amount of customers into this one store that my partner went into. However, my partner spoke up and said to the staff, hey, right now you as a business are required to be have only about 25% of your regular amount of shoppers in the store at the same time. So the staff responded quickly, and they actually had a line form of shoppers outside, uh, so that it wouldn't be crowded indoors. So that's another example of how it's kind of a new society where we're accommodating the need to keep each other and ourselves safe. And basically, the faster we get on board with all of these preventative measures, hopefully the numbers will die down. And once we can have more effective treatments available for this virus, which many people are working on right now, but none are official or being rolled out, then hopefully we won't have to be as restrictive around how we interact with each other in public. The county also updated a lot of their other guidances that can be found on the coronavirus-sd.com website. Um, for example, around face coverings, um, it's everyone is encouraged to basically wear one whenever they are outdoors, especially if they will be around others who they don't live with. But there are also some exceptions, and that can be found on the um, guidance as well. I kind of wanted to ask, and I hope this isn't intrusive, but if anyone feels free to share, if they have any personal experiences with COVID and would want to share a story around maybe collective problem solving around that. Oh, I see there's also a question here. Do you have advice on asking people to step back when they are closer than 6 feet? Yeah, some people seem irritated when you ask. I'm going to like that question. um, any of the community health workers, you are definitely more than me spending time in conversation with members of our local San Diego County communities. So, what would you say?
Um, this is from what I have observed, and from tabling in front of, sorry, I shared my PDF, in front of grocery stores. A lot of people do come by, and they do not stand within 6 feet physical distancing. So I would say, oh, I'm sorry, I have to follow the protocol, the rules, for your own safety. I have to be 6 feet away from you. And so you would, politely say that, oh, I'm sorry, I have to follow the rules.
And then what if people say, here, I'll share my video too, so you can all see what I look like. Hi. Um, what if people say, well, it's a personal choice? I don't have, these aren't real rules. What are they going to do? Arrest me?
So, if they refuse, then you just have to, step away, and don't have any confrontation with, the person that you're interacting with. So there's a phone line that you can report. So you just call that number. I'll write it in the chat box later to report any violations.
Thank you. Yeah, hopefully we don't want to get to that, but it is there to use as needed. Businesses can also be reported for violations as well. Um, so I think it would be more effective, though, to help cultivate a culture of we're in this together, right? And me wearing a mask, for example, is me being considerate of you, but it's also helping protect myself. And, I don't like all of the restrictions set in place um, because of this pandemic. And so, if we work together by minimizing the spread of COVID, then this is how one day we won't have to live like this, right? Being kind of encouraging and in solidarity with each other. And it's hard too, right? Because, this is um, complicating a lot of things for people's mental health. It's very stressful. So it's also good for us to, um, try to see where the other person is coming from, right? Um, everybody, nobody wants to be sick, basically, right? It's not fun. You basically can't do anything else if you don't have your health. And so we just need to keep that in mind as we're dealing with this, right? If anyone else wants to share, or you can also ask questions by unmuting yourself. Um, I don't know if any of the CHWs are monitoring if there are any questions from Facebook.
Dominic, I would like to add regarding the grocery that I did a tabling in one of the grocery, and then there's a lady approached me and asked me, "Are you working here?" Oh, I said no. I'm just here for the giving flyers and update for COVID-19. And then she said, "Oh, because when I'm in a cashier, like falling in line, the one that's behind me is keeping close to me, and I always keep telling him that you need to have a 6 feet distance between us." And I think the guy didn't follow. So she said, maybe you can tell the manager of the grocery that they have a video recording, like a recording, like every 15 minutes there is an announcement to have the distance, the wearing of masks. So everyone in the grocery store will be reminded that they need to do, and they need to follow the protocol, because it's the protection of everyone. That's it.
Thank you very much, Jeanette.
Mm-hmm.
Appreciate that.
You're welcome.
We have about 13 minutes until 8 o'clock. Uh, if anyone else has questions or would like to share, oh, Tracy.
Yeah, so I was wondering if anyone would like to discuss about the vaccines. I know that we have heard in the news that Moderna has what, over 90% effective rate right now, and so if you'd like to discuss about the vaccines, we could do that.
We have a shy group, maybe. I recently saw on Instagram, actually, hopefully this is allowed. There is a Canadian scientist who puts out posts around COVID, and there's one post she made that describes the different types of vaccines there are, um, based on a recent New York Times article. Um, do you think that would be a good idea? There's like 5 different types of vaccines. If folks are curious about that, I can try to pull up the video and share it.
And also, if you like to become one of the volunteers, to get the vaccine, UCSD is looking for volunteers right now, and I can get that information to you as well. You can either call the number or email them that you would like to volunteer to get the, for the.
I'm also thinking
So
about, oh, go ahead, go ahead.
go ahead, Dominic. I was gonna read out the numbers, so if anyone would be interested. So the number to sign up is 619-742-0433, or email info@covidvaccinessd.com.
Do you mind repeating the number so I can type it in the chat?
Sure, I will do that. It's 619-742-0433.
Thank you. Also, if anyone has had COVID and healed from it, and uh, and the thing is, some people can develop antibodies after they have had COVID, and there is an experimental procedure where people can donate their blood, which contains antibodies, and then those antibodies can be isolated and given to people with COVID infections, in an effort to help their bodies fight off the infection with those antibodies. Antibodies are also a lot of the time part of vaccines and how they work. So I think that's kind of cool. That's another way that folks can volunteer and physically help each other, right? Although it's still in the testing process. Um, I also want to kind of acknowledge that this pandemic has been quite a different experience for people, depending on different socioeconomic um, factors, right? For people with more resources and more access to adequate healthcare, um, this pandemic may have been a lot easier to handle than a lot of other folks that don't have those resources. Um, and for communities of color, we're also seeing in the statistics that, Black and Brown folks are having higher rates. And to make a note about stigma, for the last several months, especially Asian folks have had to deal with discrimination from ignorant people who are looking for someone to blame for COVID, but they are not acting based on facts or science, right? Um, there are also some resources we can share with y'all around combating discrimination and stigma around COVID-19. But basically, sticking to facts and science is one of the ways that we can clear up stigma and discrimination, which basically takes away reasons for people to place blame on people for COVID, which is obviously not our slash their fault, right? Um, Not to get too political, but it's a reality, right? In our communities. Not only do we, Asians and Pacific Islanders, for example, have to deal with the impact of COVID, but the social side of that as well. So, you know, that's also one of the ways that we can support each other across communities is by helping educate and hold folks accountable who are behaving inappropriately to our neighbors, right? Because uh, at least this call is geared towards everyone who's a resident of San Diego County. And again, we're all in this together and we've got to find our way out of this pandemic together. That's the only way this will happen. So we have about 5 minutes left. I don't, there's, it's not necessary for us to use the rest of our time if no one else has questions, but I really appreciate the time we've had together so far. 2 days from now, we have another town hall just like this, but depending on who attends, we'll have different questions and discussion. And depending on any updates on the pandemic, because this is a quickly changing situation, we'll try to share more updates as they come. So feel free to attend on Friday. It's at the same time, 7 p.m. Or if you know anyone who could benefit from this, feel free to share this with them. It'll be recorded and put on Facebook and also on YouTube on the UPAC SD channel after today. And translations will also be available. I also want to mention that UPAC is one of several community-based organizations which has received funding from Live Well and from the county to help have a culturally relevant and responsible uh, way of communicating COVID information from the county to various communities. So if you're looking for resources in Spanish, for example, well, first of all, the county website has a lot of different languages available, but also the various community-based organizations specialize in different communities that are at that are more severely impacted or at higher risk. So we can share that as well, our other community partners. Tracy, I thought you were going to say something. So.
No, I was going to say thank you so much for the presentation, and hopefully we have more attendees on Friday.
Yeah, and thank you again to everyone who helped to put this event on. Thank you to our community partners, to our attendees, and just to our neighbors, right, in San Diego.
And please help share or spread awareness of COVID-19.
Yeah. Thank you. Stay safe, stay healthy, and feel free to reach out to us afterwards as well. We can provide